Established in 2008, the TATA Social Internship is a unique 2-month experiential internship for students from the world's leading universities in the sustainability projects of TATA companies in India. The internship program has taken students to far-flung areas of India where the TATA companies have a presence and provides them with a grassroots level exposure to the real India and its culture while bringing international perspectives to the company's projects.
I joined the TATA Social Internship seeking more experience in India.
Last year my friend Alexandra did the same internship in India. She really recommended me this project.
And it's interesting to see what kind of grand level that TATA can really pursue their social responsibility as a huge global private company, which is something I haven't seen in the UK thus far.
And what I really wanted to do was see how people's lives can be changed in a positive way, but outside government.
Is that I've always wanted to give back to the country. That's formed a large part of my identity.
I'm studying in the microbiology department at TATA Medical Center. I'm studying gram-negative infections and antibiotic costs and mortality rates associated with those infections.
Internship is about financial literacy and kind of evaluating ways that we can expand an existing CSR course.
So I've been working in the 1,000 Schools project, which is a government initiative, which TATA and the NGO Aspire have been working on together. So within the 1,000 Schools project, I've been working within learning enrichment programs, and I'm analyzing the technology gap and looking specifically at tablet usage inside the classroom and how to improve the effectiveness.
The project is about economic empowerment of women through helping them with marketing strategies for the local bag-making and tailoring unit.
This program is an initiative started in order to skill some underprivileged women in this community. So they have come from the handloom weaving families, and typically girls are not allowed to be doing the weaving, but with the help of the hotel's initiative, the girls have been given the opportunity to learn to enhance their skills.
My project is interviews and documentation through case studies. My focus is on the 1,000 Schools project, which is a Tata Steel project to increase the access, quality, and the community interventions of 1,000 schools in Odisha.
So the project I'm working on is about belief systems around maternal health. What I need to do is to go into village health centers and self-help groups and people's homes to talk to them about what they believe about maternal health. Okay, so for example, before pregnancy, what do they do during pregnancy? Do they eat certain things? Do they avoid certain things? And after pregnancy, do they, for example, breastfeed? Do they have to look after their children in a certain way here?
The look at all the different artisan and craftsman initiatives that Taj Hotels provides livelihood for. So there are different platforms the hotel provides. One is space in the hotel. Some hotels are sourcing the craftsmen's gifts for the guests in the hotel.
TATA tries to help them with scaling up. This is a crucial thing. But so just to give you a couple of challenges they face is, for example, they struggle with procurement of resources at the cheaper price. So as a result, they cannot shape it. They cannot sell it at the local market at the competitive price for local vendors, schools or other institutions. So we try to give them skills in business through Umang. They're already having some programs, but it's still not sufficient, and it's a very long process. Scaling up, you rightly pointed out, is the main issue here.
There were lots of projects that were more people-focused and from a more social aspect, but I was interested in using the skills that I had learnt at university from my economics masters in data analysis, and this was something that enabled me to use that in a developing country context and straight from the source rather than secondary sources, which is what I'm used to working with back in the UK.
You have a lot of kids from tribal backgrounds who couldn't even speak the local language, but now after a year into a program like an LEP, they're fluent in Odia. They're managing to write paragraphs and sentences, and they're also learning basic English rhymes and English words.
Within the school specifically, it's been really amazing to see all the work that TATA has been doing with the resources they've been given. Every teacher that I've come in contact with, every facilitator, which is similar to a supervisor, is so dedicated. It's been really amazing to see all the work they've been doing.
I look at patients who were admitted in 2016, any patients, cancer patients that had a gram-negative infection, and that includes E. coli, salmonella. They're some of the most serious infections that a patient can get, and they're all patients who are in the ICU. And so these patients a lot of them are on the brink of death, and so I found that the mortality rate was about 44%, which is extremely high, and they also had some of the highest hospital bills out of any patients in the hospital. You have all these government schemes, even though this is a private hospital, and you see TATA, and it's able to subsidize a lot of these costs, and how important this CSR and how important that is for patients on their day-to-day lives.
What the hotel is doing is trying to support these artisans further. And what I'm doing when I'm meeting the artisans is I ask them about their background and their hopes, their dreams, as well as how the hotel can support them further.
One incident in the residential bridge school which moved me actually quite a lot. So they were playing this activity where they sat in a circle and they had to throw a ball to each other, and when they threw a ball they'd ask a question and the person receiving the ball would answer a question. And a lot of the times the question would be, what's your grandfather's name, what's your mother's name, what's your father's name? And so many of those kids would just say, I don't have a father, I don't have a mother. And that was such a really, really sad and sobering moment for me. I had to sort of leave the classroom and sort of take a moment, because for me that was just really, really shocking to see.
Quite a few of the classrooms we go to are located in rural slums, meaning they don't have walls, they don't have electricity, basic things that every school needs to have, they're missing. Quite a few of the girls have issues during their menstruation time because they don't have running water or they don't have toilets.
Most of my field visits are done on a motorbike, and so during monsoon season it's very difficult to get to these remote schools, which also makes me think about how the children travel to these schools. Most of them are walking or biking at least 4 kilometers.
I think looking forward into the project, it would be interesting if we could also have looked at other possible hospitals, especially TATA hospitals, to kind of compare and contrast the data. So it's not just comparing with this hospital, but an exercise in looking at comparison across the healthcare system as a whole. And that would have been something that would have been quite interesting to look at as well.
I realized that even though we don't speak the same language, most of these beneficiaries speak only the local language, which is Marathi. Some of them spoke very little English. I felt quite attached to them.
What's been special for me is being able to speak in Hindi with them. So I have just taken 1 year of Hindi in college, and for me this has been very transformative.
I have become very good at charades and smiling, because that seems to break the language barrier.
They have these activities called teaching learning methods. So far they've been a big hit. It's helped the teachers overcome the language barrier as well. I think more of these should be implemented, especially in the English aspect. It could help them learn how to speak and read and communicate more fluently.
Another challenge is time management. So the work ethic is different.
I guess easygoing, if things are going to get done, they'll get done, and kind of being okay with ambiguity is something else which is really important.
You know, sometimes I do think that there are cultural differences. I think as an American in the workplace, we have kind of a 9-to-5 strict schedule. We expect things done, you know, on the clock. But in India, I think I've learned I need to become more flexible.
So for me, I'm able to go home and remember these moments and feel inspired by the passion that they have for their craft. It's very difficult work, and yet they still want to keep this craft alive. And for me, this is very honorable work.
So from that perspective, it's given me a lot of confidence in what I believe I can do and in shaping my own interests, and I think it's also going to help me later on professionally.
Learning how to interact with people in a professional sense rather than a social sense is really, really important to me as well, and obviously having that international aspect is also super important.
This project helped me to understand the people better, and also I learned some patience in dealing with different issues, and I learned how to be adaptable more to changing circumstances.
Well, I really admire all the dedication that I've seen with the students who absolutely want to learn, which I've noticed is a bit different than in the United States, with the teachers who get up every day and work their hardest to really help these children, with the TATA staff members who are also dedicating themselves. And I think I'm going to remember this experience of how hard they're working to change education back to the United States, and hopefully continue with that work ethic.
This internship is a great opportunity for me to be able to pursue my studies, not just through books, but in real life, and see how, you know, companies are able to make an impact for people.
This is an experience like no other, and they provide so much support from people coming from different cultures and countries, and coming here to live in India for 2 months. It can be a daunting experience for some people who maybe haven't traveled to countries like India or even traveled out of the country before, as it is with some of the other interns.
Ideally, one day in the future, I can work at a company like TATA or an institution that values the empowerment of the local community it means to serve. And I think that's become a #1 priority going on after I graduate because of this internship.
A vital part of the internship is the challenge of working in the vastly different environment of developmental initiatives in India, and these interns have coped bravely with the handicaps of language and embraced the cultural differences presented to them. Overall, the experience had been enriching and helped the interns gain a more empathetic and complete worldview.
One day I will be settled here and be able to have a community that I give back to as much as they have given to me.